Hello and welcome to A Fresh New Me. I'm Dr. David Heise. I'm the owner and operator of A Fresh New Me, and today I'm going to be talking to you about intense pulse light therapy. Intense pulse light therapy, or IPL as it's commonly known, takes a bright intense light and it takes up pigments that are in the skin and it breaks them up to give a much more uniform appearance. With Alana, she's a very fair-skinned person, and we've already done her face, and you can see in looking at it that her forehead and her cheeks are very smooth and uniform in appearance, and she does not have a whole lot of freckles left. Whereas if we go down to an area like her arm down here, you can see that she's got numerous freckles. One of the areas that we want to go ahead and treat today is her décolleté, which is also called the chest area. And we want to go ahead and try and see if we can remove some of those other freckles in that area as well. So this is the Harmony XL Pro put out by Alma. And again, this is a light therapy treatment. It's not a laser treatment. So what we'll do is we'll go ahead and we'll get the machine started up. Hit the start button. And when we talk about machines, you know, is IPL IPL? It's not the same. The machines are very different. This is the latest and greatest technology. And normally when we talk about treatments, whether it be IPL or lasers or other instruments, what you're looking at is the technology really provides more patient comfort, typically does it faster and does a better job of it. A machine that may be 30 years old may do it, but it may cause a lot more pain, take a lot longer, and may not produce as good a result as we can get with a machine like this. So what we'll go ahead is set our settings, and we'll put it on DIVL. We'll put that at 15. And the fluence, which is a measure of energy that we're going to be using, I'm going to put at 13. For cooling, the head of the laser light actually has a cooling head in it. And you can see it looks like icy blue right now. And it will get actually icy cold. So I'm going to set the cooling at 75% for her, which is about the maximum that we should use. It's time for me to go ahead and don my goggles. And now at this point, I'm going to go ahead and take some ultrasound gel. And put it on her. I'm sorry if that's cold, Alana. All right. On the hand pieces, we always want to put our little hand guard on to make sure we don't drop it. And it's in standby mode. I'll go ahead and put it in charge mode so it's ready to fire. I'll go ahead and take this head, which you tell me if it's cooling.
Definitely feels good.
All right. So Alana says it's feeling pretty good. So what I'm going to do is I'm going to start here and do an initial burst. And what I want you to see is when you look at the light, notice how a little bit is showing at the bottom, kind of like a light peeking through on the bottom of a door. Now when I do that, I'm going to go ahead and say 1, 2, 3 and hit it. And that's one pulse. Was that okay?
Yes.
All right. And now I'm just going to start moving along. Are you doing okay there?
Yes.
And you can see that the head on the IPL here is fairly large. It's about 1 centimeter by about 3 centimeters. A lot of the heads on the other machines are much smaller, and so you have to do more hits and it generates more heat. Is it getting a little warm for you?
It's okay right now.
Okay, nothing you can't tolerate?
No.
If you had to rate it on a scale of 1 to 10, Alana, what would you call it?
About a 5.
All right. And what I try and do is block off certain areas. I try and do an area somewhere around 10 centimeters by about 15 centimeters. Whenever we do these treatments, we kind of mark off the body in different grids. And it just makes it easier to go ahead and remember where you've been and what you have to do. So you can see I'm just kind of going along a little stamping type fashion. You can probably see that her chest is getting a little bit red in those areas. Still doing okay there?
Yes.
I'll continue on along. I'll go a little up towards the neck area, but not entirely. Still doing okay?
Yep.
Okay, and we'll go ahead and we'll stop right about there. As you can see, the whole area kind of red. Does it feel a little bit warm?
Feels like a sunburn.
Okay. Now, if you want, we can go ahead and go over to the other side. I'll go ahead and move my chair over there. I'm just going to take my foot pedal and put it over on the other side. Is that okay across your legs?
Yes.
All right. And we'll go ahead and we'll put some gel on her. And get her ready to go on this side. Sometimes I think the gel is the worst part about it because it's so cold. All right. And we'll go ahead and just spread it out. Is the head staying cool enough?
Yes.
All right. And on this, I'm going to go ahead and start. Actually, I'll do it with my right hand. What's nice is it doesn't matter what one you hold it with. You've got your foot pedal, which actually triggers it. There's no trigger on the actual head itself. So, all right, ready? We'll get started. And typically, people want their faces done. The chest area is a very common place to do it. If you have other areas that are what we call hyperpigmented, like a big brown spot, we have little shields that we can use on them to go ahead and block off that area and hit it with a much higher intense pulse of light. And in doing so, we can go ahead and get those areas to disappear as well. I asked Alana before she came in today if she had any of those spots, and unfortunately she doesn't. Otherwise, we'd go ahead and zap one of those as well. Are you doing okay?
I'm doing well.
All right. And we're on our last pass up here. And again, you want a little bit of the light to peek out from underneath. All right. And that completes our IPL treatment today. So how'd you do?
Well,
All
this feels
right.
like a light sunburn.
Very good. All right. Thank you. And I hope to see you at a fresh new meet.